episode number 95 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Kristin Cornett. Kristin is a certified nutritional therapy practitioner with specialized training in functional medicine, women's health, and fertility. She works with couples all over the world through her virtual fertility practice called Tiny Feet and also hosts the Mastering Your Fertility podcast. Kristin uses a unique functional medicine approach that gives couples the tools they need to get to the root cause of their health and fertility struggles, conceive successfully, and set their babies up for healthy life from the beginning. Her passion for fertility work comes from her own lifelong battle with health issues and years of trying to conceive without success. After finding answers and healing through nutrition, functional medicine, and mind-body work, she's determined to bring the same hope and healing to other couples so they can build the families they've always dreamed of. You can learn more about Kristin on her website at tinyfeet.co. So welcome to the podcast, Kristin.
Thank you, Michelle, for having me. This is great.
Awesome. So can you share your fertility journey and how that inspired you to do the work that you do today?
Sure. Yeah. It's kind of a long story. It starts a long way back, but I'll kind of gloss over the part of it that isn't the last 5 years. So I grew up kind of a sickly child. I had a lot of health issues from early on in life. And that really kind of affected how I grew up and how I thought of myself and my body. Oddly enough, though, I didn't really consider that any of like the immune system problems or the gut issues or the mental health issues or any of the things that I was suffering from, I didn't really consider how that might later affect my fertility. So my husband and I quit birth control at the end of 2014, right after my husband and I got married, and we started trying to conceive in early 2015. And things did not work out like we planned. My cycle came back, but it was very irregular. I had tons of just crazy monster-like symptoms every month. I was having a lot of mid-cycle bleeding. Things were just not what I expected them to be. And I had had painful periods prior to going on the pill. But I guess it had been such a long time. You just don't really think about you just think your body's going to go back to normal or whatever normal is supposed to be. And I think a lot of us feel that way where we go on birth control because we're intending to prevent pregnancy for such a long time. And the narrative is always like, oh, you can get pregnant anytime. You need to protect yourself. And we don't think about the fact that, hey, we're messing with our hormones and that might have consequences down the road. So I didn't really think that there was going to be any issue when I came off birth control, despite the fact that I'd been sick and kind of unwell for many years. And so it had been about probably 18 months unsuccessfully trying to conceive before I was like, I just feel really intuitively like my health issues, like all the stuff that's going on with me, especially the digestive issues, which got much, much worse after coming off of birth control. I just started to feel that instinctual, intuitive feeling that those things were connected to my fertility. And I didn't have anybody that I was working with at the time that could tell me how they were connected. I had started seeing a naturopathic doctor, but all of the focus was really on my hormones. It was kind of like Band-Aid type of supplements and treatments to address symptoms, but we weren't really digging in and getting to the root cause. So I started asking for some of the testing. I started doing some research on my own. I started asking for the first thing I asked for was a food intolerance test. Then I asked for a small intestine bacterial overgrowth or a SIBO test and found out I was positive for that. And once I discovered that I had that issue going on in my gut, that really became the focus of my healing journey and figuring out how to address that. Ultimately, that ended up leading to me starting at the Nutritional Therapy Association and getting my certification in nutritional therapy. And then that led to 15 other certifications since that first one. I discovered some healing through dietary changes, and I really wanted to explore that more, how nutrition could affect healing in my body and how that could ultimately impact my fertility. So it was kind of a spider webby type of journey where I took a lot of different paths and tried a lot of different things. But my ultimate goal was to become the practitioner that I wish that I had had at the very beginning of my journey. Like if somebody had told me all the things that I needed to look into with my health, if somebody could have assessed me and said, okay, you have this going on, this going on, this going on. These are the tests that you need. Here's a framework for how to look at this. Here's how all of these things impact your fertility. And here's a plan of what you can do about those things, like comprehensively, all at the same time with the same person. I would have just jumped on that. I would have been so excited to have that. And so throughout all of these different journeys that I've taken and certifications that I've done and trainings that I've done, that's really what I've ultimately been seeking to create, is something that can help bring all of those different factors together that I wish I'd had when I started.
Yeah, absolutely. And you also found out you had Hashimoto's.
Oh yeah. Thyroid disorders. Then I found out I had intestinal parasites and other infections. I found out that I had like serious cortisol dysregulation from chronic stress. I found out I had low progesterone. I mean, things that I feel like I could have known earlier in my journey if I had known where to look. And back then, I mean, I don't know how many podcasts were out on this subject. I mean, obviously I have one now, so I know that there are quite a few that discuss fertility, but not that many that discuss it from the perspective that I needed to discuss it, which was not just what's up with your cycle, it was what's up with your health that's causing the issues in your cycle.
Totally. And I say this all the time, that our bodies are more concerned with survival than reproduction. And it's just that it's always a reflection. If there's any reproductive health, it's really a reflection of what's happening behind the scenes.
Yeah.
And so, it's great that you knew that. Like,
yeah, there's no education about that. There's nothing available in conventional medicine that tells you that your gut, for instance, is connected to your fertility. But when you really start to break it down and think about it, like even if you're not super educated from an anatomical or a physiological perspective about why that is, it's like, well, your gut is responsible for all of your nutrient absorption, and nutrients help your ovaries function properly and form the backbone for you being able to build hormones in your body. So there's so many connections that I don't think are emphasized in conventional medical training. So doctors aren't taught to think of it from that perspective. And thus we grow up in like a medical education system that doesn't teach us how to understand our bodies or how to intuitively think about our bodies and make connections for ourselves. We're taught, you have a problem, like you wait until you have a symptom or an issue, and then you go to the doctor and you get a treatment for whatever that symptom or issue is. It's not that underlying investigation into what caused it in the first place.
Absolutely. And I was also thinking about another thing when you were talking about the birth control pill. So many doctors will say, oh, take this as long as you need, as many years as you need. And when you're ready to get pregnant, just get off.
Yep, that is definitely a common thread. I see that a lot, in particular in clients that I see in my practice that went on the pill for non-reproductive reasons. They weren't trying to prevent pregnancy. They were trying to address issues in their cycle, such as irregular periods, like doctors handing out the pill for no period or suspected PCOS without even doing a proper evaluation or allowing enough time for the cycle to regulate prior to.
It makes me crazy.
Yeah,
it makes me crazy because it just, I don't understand. So like, okay, so let's pretend we have, like, I'll make this patient feel better just so they could think they're having a period every month. I mean, like, it makes no sense whatsoever. So like, I'll make them bleed every month, but it's not really their period, just to make them feel like they're getting their period. Then it's like, what's the point of even wasting money on tampons and pads if if you're not really getting the periid?
I don't think most women know that they're not actually getting a period, that they're getting a withdrawal bleed.
But the doctors know.
Yeah, I'm assuming that the doctors understand the mechanism of action behind birth control. But what it does is that it fixes the issue that the patient comes in with, but it doesn't address the underlying cause. Like it addresses I don't have a monthly bleed, so this will give me a monthly bleed. That fixes that. It masks the issue by fixing the symptom.
Right.
But it doesn't address the underlying cause of why there was no period in the first place. And there's so much investigation that can be done. And that's why looking at health and wellness more from that functional perspective, like what functional medicine really is how is the body supposed to work and how can we support it to work the way it's supposed to? Right. It's pretty simple, really.
It is. It's very simple. And it's more doctors should be learning this, I think, in today's day and age. And actually just There are some great doctors that have actually gone back and studied functional medicine, which I'm really happy about.
Yeah.
Because it means we're moving forward and just understanding that, going from the Band-Aid philosophy to actually going to the root cause, also having faith in the body's ability to heal itself, which with functional medicine and Chinese medicine, I think that that's something that we hold as a similar philosophy, really, is that the body wants to heal. The body's designed to heal. It's programmed to heal. It just has issues when there's a lot of assaults like toxins and dietary assaults. And so it's just kind of like behind the 8 ball. And so we're trying to get the body to get whatever it needs. Like you said, if you have any kind of issues with gut, then you're not really getting the nutrients you need to have the energy to regulate your body.
Right.
So what were the most impactful changes that you've made, that you feel like you've made to improve your health?
Oh, that's a
lot.
big question. Yeah, that's okay. So the gut health piece was obviously essential. Getting proper testing, I think, was a big piece of that. Like, I never would have known that I had parasitic infections in my gut without testing. What can happen is, like, a lot of conventionally minded practitioners will go, okay, let's like just do a stool test for certain pathogens, but like they can really only collect or assess when there's an active infection. In my case, it was like something I'd picked up a while ago that was hanging out chronically in my gut. It wasn't causing the acute symptoms that you would normally associate with a parasitic infection. I had Giardia and Cryptosporidium, which are both nasty infections. Cryptosporidium is commonly picked up from pool water and some other places. Giardia, I believe I got from pets growing up that had Giardia infections. And so those things were just chronically hanging out in my gut, causing inflammation. They were causing a hugely magnified immune response. So my body, my immune system was like trying to address and attack this thing. It's very common to see a compound called secretory IgA really elevated on a stool test when you have a parasitic infection, which I did. Having a damaged gut or dysbiosis like that over time can also cause food intolerances, which I had many. And so kind of cleaning up my diet, removing some of those inflammatory triggers, that was really big for me. I'd done several elimination protocols and not really gotten results because I was only addressing the food piece, not the gut piece. So it was really important for me to address gut health and food intolerance at the same time. I also obviously needed to dig in deeper and figure out what was going on with my thyroid because I don't think I had ever had a full thyroid panel before I had one that also tested antibodies and found out that I had elevated antibodies to my thyroid. And so taking out some potential trigger foods, like with thyroid disorders, particularly with Hashimoto's, it's really important to remove gluten from the diet. Most people are also quite sensitive to dairy. And the reason for that is that there is a common protein thread between thyroid tissue and gluten protein. And so the body can easily start attacking thyroid tissue when it is also mounting an immune response to gluten. So thankfully I had been gluten-free for many years when I discovered my Hashimoto's. Dairy was a little bit more intermittent for me. So kind of tightening up diet, I did an autoimmune protocol. And for those that aren't familiar with AIP, it is basically a paleo style diet that also removes some additional food triggers. And these things they're not unhealthy foods. It's not like you're saying these foods are bad all the time. They are potentially immune stimulating to people who already have a damaged digestive system, which I had, and people who have started mounting immune responses to a lot of different foods. So a paleo diet traditionally removes grains, gluten, dairy, refined sugars, processed vegetable oils, things like that. But an AIP protocol also removes eggs, nuts and seeds, nightshade vegetables, alcohol, and some other unfortunate things like chocolate and coffee. But it's temporary. Like you don't stay on that type of a diet for a long time. And when I first did it, I didn't know that. Like I just tried to stay on it a long time. And I was just like, oh, I'm just going to keep eliminating. And that didn't really create a very healthy mindset around food. And then it became really mentally and emotionally difficult to reintroduce food because of all this fear. So I think it's important, if you're going to take on an elimination protocol like that and you're looking to achieve really specific results, I think it's a good idea to be working with somebody who can direct you through that and tell you when it's time to start reintroducing foods. And if you're not seeing good results with reintroductions, that's a sign that you need to dig deeper and figure out if there's something else going on. I've also done Dutch hormone testing, which, for those that aren't familiar, it's a urine test for comprehensive hormones that looks at kind of all the things that impact fertility. So we're looking at cortisol, we're looking at estrogen and its metabolites, progesterone metabolites, your DHEA, testosterone and how it's metabolized, melatonin, nutritional organic acids. That's how, one of the ways that I discovered I had low progesterone other than symptoms. And low progesterone is a toughie because it's really dependent on ovarian function to a large degree. And to address the root cause of low progesterone without Band-Aids, without supplementing progesterone, you really have to address whatever the root cause is that's impairing that ovarian function or not allowing that corpus luteum to produce sufficient amounts of progesterone in the second half of your cycle. So you have to address things that are harder to look at, like chronic stress and overproducing cortisol and, inflammation, and women who experience autoimmunity, like I was experiencing, can frequently struggle with their progesterone production, and just the overall health of their menstrual cycle. So those are all things that I had to look at. And more recently, I would say, I've really been digging into the mind-body side of things. With autoimmune conditions in particular, the mind is so powerful in how it directs the immune system to function. And there's so many awesome studies about this and how the brain, like there's a whole field now called psychoneuroimmunology, which is basically how your thoughts and beliefs like turn into matter. They direct your immune system to produce certain compounds, and you can either create an environment in your own body with your thoughts and beliefs that is pro-inflammatory or anti-inflammatory. And I'm like, oh man, I've been doing all these physiological things, and yet some of these thoughts and beliefs that are just recurring and very underneath the surface in my life. Like I'm a very type A person. I've always been kind of self-critical. I've used that as like motivation to get things done in my life. But that was ultimately not serving me very well, because like self-criticism, beating myself up, like trying to self-motivate from a place of negativity was destroying my health. It was creating a lot of inflammation that was totally unnecessary, and it was completely within my control. But it was a harder area to address. So that was a long answer, but hopefully that covers some of the big things. Feel free to ask more details on any of those things.
It's fascinating. I mean, what you just mentioned about, the mind and how it can affect inflammation. And it's interesting. I mean, we all find certain behaviors or certain patterns that we feel at one point in our life served a purpose. And they do. Even though they're not always great to keep around for a long time, at one point it served some kind of purpose. But it's really kind of taking and looking at, reassessing what you're thinking. And I call it like we're constantly affirming things, but we can either consciously affirm or unconsciously affirm. But we're always doing that. It's just the way the mind is. We're constantly affirming and repeating, and those are the patterns that we are part of. So I think it's just so fascinating. And we had actually talked about Joe Dispenza last time we spoke.
Yeah.
You Are the Placebo is just such a fascinating book. And how you were mentioning, when I was on your podcast, you had mentioned that Western medicine or science has been looking at the placebo almost like kind of not really giving it much importance. Oh, it's just a placebo. It's just a placebo. But like to really think about what a placebo is insane. It's so powerful.
I think people think of the placebo effect as something that's fake, like it's not real.
Right.
Like people can't improve unless you give them a real treatment. One of the best examples of this is with antidepressant and psychotropic medication. It's like kind of the bane of the existence of that particular field of medicine, how strong the placebo effect is in those trials that look at antidepressant medication, because people who are not given the active drug improve at the same rates as people who are given the drug. Yeah. And so that really begs the question on how we're addressing mental health issues.
Right.
in our society. But it also brings up other issues with different types of drugs, is like, we're seeing the same improvement in some of these trials when there's drug therapy given versus when there's not active drug therapy given. And the placebo effect is looked at as something that's fake or not real, but there are clearly measurable improvements,
Yeah.
not just in like lab testing, of course, which matters. Like, how do your labs look? Of course, that matters, but like people's quality of life and how they feel on a daily basis. And if they're improving on a placebo, meaning without the active drug that's being given in this particular trial, we need to investigate that more. We need to understand what's at play. We don't need to just write that off and treat it as this like kind of annoying thing that exists in medicine that we wish didn't happen, that we try to like get around in some way. We really need to look at that and say, what is it about this placebo that helps people get better? Like, why do people get better when we don't give them a drug?
Yeah, and it brings up to my mind is that we underestimate ourselves. Doctors underestimate that you can't get better without medicine. We underestimate our power as human beings.
I would completely agree with that. And I think it just in my personal journey, that has been so true. Not giving myself the credit. And it's funny because like I'm a person that has always thrived on having a certain level of control in my life. And yet I had totally given away my control over this particular area of my life. Like I was able to eventually go back and have a little bit more control over what I was allowing my mind to focus on. But it required a really intentional look at what was my mind focusing on, first of all. How did it get to that place where I was focusing on some of these things that were creating like a more negative, more inflammatory environment in my body? And then what do you do to really dig in and start to investigate that and change it? I think there's also some identity that's wrapped up in that. I think I've talked about this on a podcast episode on my podcast a long time ago, actually, maybe halfway through the life of the podcast so far. I had an interview with Spencer Broussard. She's a life coach, I think in Canada. And it was just really interesting, like talking about some of that negativity. And we kind of build some of those things up as like identity, the self-criticism piece, the pushing ourselves like way beyond what's reasonable for a human being to do. And my comment to her on some of that was like, it's really difficult to start to strip some of that away, because then you wonder, like, if I changed this particular belief about myself, if I didn't push myself so hard, if I didn't think about myself in this very critical way that has always pushed me to be better, like, who would I be without those things?
Right.
And then you get this like big kind of identity crisis. And, there has to be room in your life to explore those things. And I've had trouble making room in my life to explore those things because I'm like, no, my daily life is just way too busy. There's too much going on. Like, I don't have time for this growth. And then it's like, well, do you really have time not to do it? Because it holds you back in all these really important ways. And if you really care about your health, especially your mental and emotional health, like, can you really afford not to do that work?
Oh, I love that. That's the question. Can you afford not to do it? Totally. Yeah. And then as you were talking, I'm thinking about the gut-brain connection, which is a whole other thing. And I was going to actually go back to the gut because a lot of times in Western medicine, they think the leaky gut is like fake, that it's not a real thing and it doesn't have evidence, but it does have evidence. So, and there's a lot of connections between leaky gut and autoimmune conditions. Can you talk about that from a functional medicine perspective?
Yes. And I agree. Functional medicine or conventional medicine does not look kindly on some of these functional medicine terms that we use a lot, like leaky gut. The appropriate medical term for that would be intestinal hyperpermeability, which basically just means a loss of complete functional integrity in the GI tract. So when you look at your gut, it's one single cell between the inside of your body and the outside of your body. And technically the inside of your digestive tract is the outside of your body. Like, that's not, food has to get through there to make it into the bloodstream. And that's, inside your body. So this one single layer of cells is all that separates you from what's in your gut versus what's inside your body. And roughly 80% of your immune associated tissue is in your GI tract. And for good reason, because that is the barrier between the outside world and the inside of your body. And so, of course, the immune system is going to be really active in that area in terms of like flagging what's coming in, like if there are any invaders or pathogens or toxins or things that are coming in through our food, we need to be aware of those. And so the immune system is concentrated in that area. And so when we look at autoimmune disease, the best science that we have at this point tells us that there's really like 3 main factors that are involved in the development of autoimmunity. And one of them you really can't control, which is genetic predisposition. There are some people that have genetics that predispose them to the development of autoimmunity. Does that mean that if they have those genes, they will 100% get an autoimmune condition? No, it doesn't. Right. It's just one of the 3 pillars that can contribute to the development of autoimmunity. The second is environmental exposures or triggers, which could be like toxins in the environment. It could also be a previous infection with a virus or a bacteria. That's also something that you don't necessarily have control over, at least not your past exposures. But the third thing is intestinal permeability. So what is the integrity of that gut lining? What things are able to make it into the body that don't belong there? If your immune system is able to start gaining access to some of these things that really don't belong in the bloodstream, like incompletely digested food particles or bacterial toxins. There's a class of bacteria, gram-negative bacteria in your gut that produce something called endotoxin. It's called lipopolysaccharide. And when that makes it into the body, it's very inflammatory and it's not supposed to be in there. And there are certain things like having a leaky gut or like even consuming a lot of alcohol can increase the transport of LPS into the bloodstream. So a leaky gut is really a prerequisite to the development of autoimmunity. It does exist. We can see it in studies. And it's a hugely important factor to consider with any immune-based issue. And that includes things that aren't always thought of traditionally as an autoimmune condition, like allergies or hives, random hives, or eczema, for instance. Like eczema really is in the autoimmune category of conditions. We don't think of it to the level of severity that a typical autoimmune skin condition would, like psoriasis, for instance. But eczema is a good sign that your body has kind of a pissed off immune system and it's starting to attack its own tissue.
Mm-hmm. It's interesting. I mean, it's the whole thing is really fascinating. And so we go back to, the gluten and certain foods, and that's why it's so important, especially in Hashimoto's, for example, and we were talking about that, to, eliminate those foods from the diet, because that's constantly creating this inflammation. It's constantly creating issues with the lining of your gut, and it also, when it is inflamed, is not able to absorb the nutrients correctly, therefore weakening you and not allowing your body to get the energy that it needs to balance your hormones, to, for your reproductive health, for everything, really.
Yes, that's completely true. So gluten is a really good point. So I mentioned that specifically with thyroid disorders and particularly autoimmune thyroid disorders, but really gluten does not mix with any autoimmune condition.
Yeah.
And the reason for that is because we know from the most recent research that intestinal permeability is a prerequisite for the development of autoimmunity. But gluten actually causes intestinal permeability in everyone. And so you're consuming something that basically, for lack of a better term, tears the lining of the gut. Mm-hmm. And some people are better at healing. So the more quickly and easily you're able to heal from that exposure, the less likely you are to develop chronic symptoms. But basically that intestinal permeability increases in everyone after the consumption of gluten. And the people that heal less and less well over time, and then also have the genetics set up to contribute to autoimmunity, those are the people that are going to see that loss of oral tolerance to gluten a lot faster, and they're going to start to develop some serious immune system problems. There are other people that won't necessarily see the development of those conditions, either because the genes aren't set up for it, or maybe they aren't taxed in the same way that doesn't allow them to heal as well after a gluten exposure. So some people are a little bit more resilient than others when it comes to gluten exposure, but really it's not a terribly healthy food for anyone.
I agree. I'm team gluten-free all the way. My husband loves gluten. He eats gluten, and I'm trying to talk to him about it, because of many other reasons. But I wanted to ask you, what are your thoughts about why we're seeing so many people, so many sensitivities to gluten today, where a lot of people used to eat bread? I mean, is it because I know that genetically they've modified the crops? I mean, they don't look the same as they used to be. They have more carbohydrates, and they also get sprayed a lot, obviously. So,
Yeah.
and it's very rare. It's very difficult to find organic wheat nowadays. It's not really something that you find a lot. So what are your theories about why we're seeing this a lot more often today?
Yeah, good question. So I think there's a number of different factors at play here. One is definitely, so just to clarify, wheat is not genetically modified in the traditional sense. Like we're not going in and actually changing the genetics to make something like more pesticide resistant, not the way that we do with corn and soy,
Right.
where we've got like Roundup ready seed the way that we do with corn. What we have with wheat is basically a hybridization. So like combining two different plants over and over and over again in many different combinations until we go from like 4-foot high wheat
Right.
stalks in the field to like this dwarf wheat that's a lot more like resilient and can maybe grow thicker and is easier to harvest. And so we've basically hybridized this plant over and over and over again until we have something that very slimly resembles the wheat that grew naturally in our
Correct.
environment.
Yeah.
So this hybridization has created all these different foreign proteins. Like some plants or like species, when you combine them, you end up with like the same amount of genes and the same amount of proteins. It's just like kind of a combination. With wheat, it's very different. Like you end up with so many more foreign proteins when you hybridize plants that way that you don't end up with when you do that with other types of plants or species. So it is kind of unique in the sense that we're being exposed to proteins that never existed, that wouldn't have existed in nature previously. So I think that's one aspect of it, is just more foreign protein. And we're trying intentionally to encourage certain characteristics in those plants that make them easier to deal with from an agricultural perspective.
Correct.
Some of the
Yeah.
other issues that we're seeing are like wheat being sprayed with glyphosate as a desiccant to dry the grain, or either that or it's being sprayed during the production, during the growing season of the grain. And those, like, we know glyphosate is terrible for our gut.
Yeah.
It's basically like ingesting an antibiotic over and over again. So it can kill off beneficial bacteria. It can, that's actually what glyphosate does. It's an herbicide. We thought that it wasn't harmful to humans because the primary mechanism of action was to disrupt something called the shikimate pathway, which humans don't have. Bacteria have that. Well, guess what? We have a lot of bacterial cells in our gut, and they're super important to our health in so many different ways, and all of these different pathways, and our metabolic health is dependent on that. Our immune system is dependent on that. So we need robust levels of bacteria. So ingesting an herbicide, a pesticide that has specific action on bacterial function is really bad for us. So that's one issue, but there's a lot of other issues with glyphosate. One of the best researchers that I know is Stephanie Seneff. I think she's from MIT, and she's done a ton of research on glyphosate and the different ways that it has impacted our health. So she's a great resource to check out on the subject of glyphosate. But I think that's another reason that we're seeing so many issues with wheat, is that it's actually some of the chemicals that are affecting our body that are used on modern wheat, as well as just the differences in protein content and how our bodies digest and deal with the different macronutrient ratios and the different proteins that have been created in modern wheat.
Yeah, it's intense. Because you do see it a lot more. And even with my kids, I took them off gluten. So the three of us are off gluten. And each person, this is another confusing thing, is that each person has different symptoms. So it's not like wheat sensitivity or gluten sensitivity is going to show up the same in everybody, which is why it's so confusing.
That's true. You know, in my case, when I went gluten-free, it was a Hail Mary suggestion on the part of my husband to try to help me in the situation that I was in at the time, which was severe generalized anxiety disorder and panic disorder. And I was experiencing about 6 or 7 debilitating panic attacks a week. And a couple had landed me in the hospital.
Oh, wow.
Which was very scary and very unfortunate and very unlike me. You know, I'd never struggled with that. And of course, being somebody that was very, very much desiring to be in control, like having a disorder that put me out of control of my body was incredibly scary and very debilitating at the time. And I also had a lot of gut issues going on with that. Big surprise, mental health issues plus gut issues. And I was expecting more of like the gut issues to improve on a gluten-free diet. But what I found instead was that I still had a lot of gut issues cutting out gluten. But my mental health symptoms disappeared completely.
Yeah.
Within 2 to 3 months. And so I think it's important to recognize that symptoms of gut damage do not always manifest in bloating or gas or indigestion, constipation, diarrhea. Your gut health can be intimately related to other issues. Like maybe it's your skin, or maybe it's your mental health, like it was for me. Maybe it's joint pain. Maybe it's something that doesn't seem at all related to your digestion. Maybe you have like 2 amazingly perfect poops on the Bristol stool chart every single day and you think my gut's totally fine, but your gut's not fine. Like you are experiencing inflammation. Most of your immune system is in or around that gut tissue. So if your immune system is pissed off and manifesting an inflammatory response elsewhere in your body, you still have to look back at your gut.
Absolutely. It's such an important point because that's what is so confusing is that, it's crazy is as you were telling me this, I'm thinking, okay, so you go to the doctor or the psychiatrist, they'll give you medicine for being anxious. And that's that. Call it a day.
I got antidepressants.
Yeah.
They didn't work.
It's
because
crazy.
That wasn't the problem.
Yeah. And this is really, it's just one small example of what's happening on a huge scale out there. And which is why it's so important to have these talks and have these podcasts, because it gets people to get more educated about the possibilities and what to look into, which is why I love functional medicine so much. Getting to the root cause and the fact that we have the ability and access to get all of these tests done.
Yeah, it's an exciting time to be part of a more holistic model of healthcare for sure. And, of course, there's still conventional practitioners that are skeptical.
Mm-hmm.
But one thing that I've seen in my practice that's really exciting is that I've worked with some people that have gone back and shared information with their doctors, and their doctors were like, that's really cool. Like, you should tell me more about that. Like, I want to hear more. I actually had an OBGYN. I saw one of her patients as a client, and she she relayed all this information back to her. And the OBGYN saw another similar case that she was like, I'm not really sure what to do with this, and just referred a client to me.
Oh, wow. So, that's awesome.
Yeah, to do some of that underlying investigative work, because it just wasn't a tool that she had in her toolbox. And she's like, hey, if somebody else has it, then that's great. And I do want to go back to the discussion about conventional medicine. And I don't want to say that like all conventional providers are not taking care of their patients the way they should be. They are doing exactly what they're taught to do in school. They're using the tools that they were taught to use.
Right.
I just think it's important for us to, on both sides of the issue, with functional medicine and conventional medicine, be willing to explore the things that we have limitations on in our training.
Yes,
there are certain things that I don't know how to do because I'm not conventionally trained. And just for anybody who has a question about this, I'm not a licensed healthcare provider. I'm not a doctor. I can't diagnose and treat specific medical conditions in the way that they can be. That's practicing medicine, and I'm not licensed to do that. So there are certain things that I'm always going to have to refer to conventional providers for, but there are also things that I can do that they can't do, or that they're not trained to do, or they could do if they really wanted to. But that's just not their training. So I think it's important for us to acknowledge and respect the expertise on both sides.
Absolutely.
And if we can be more collaborative, then the client or patient ultimately gets a better experience because they have two providers with different perspectives, giving them the best of both worlds and allowing them to benefit from what each person has to offer, as opposed to this more adversarial, like kind of vying for position and credibility with the client or patient, which is completely unhelpful.
It is because, listen, my husband's a doctor and we understand each other because we teach each other, the different perspectives. And so when I hit walls, I'm very happy to send my patients to either the reproductive endocrinologist or just an endocrinologist in general for thyroid issues or whatever it is. And, also liability, like you said, increase our scope of work to be something that's outside of what we're capable or able to do. And so it is very important to obviously have that. And unfortunately, what I was speaking to before is that not a lot of people are as open-minded, but fortunately some are. And I've had many great relationships with local doctors where we do send each other people because I hit walls and they hit walls. And that's ideally what I would love to see more of. It would be great.
Yeah, that would be a much more successful model of healthcare ultimately for people. And, it would be nice to see some insurance coverage for more holistic based models of care, because that underlying investigation can ultimately lead to less money needing to be paid out through conventional
Exactly.
insurance
It
models.
may
Because if
pay
we
them.
actually, right, if we actually address root cause and help someone heal their body, just like you said at the beginning, the body's default state is health. If
Yeah.
it's unhealthy or something is going wrong, that either means that there's an obstacle in the way of healing, or the body is missing something that it needs in order to support that process, whether it be like a nutrient or maybe it's a mindset issue, whatever that is. Functional medicine is about removing those obstacles and providing the tools that the body needs to support itself.
Yeah.
So when you're doing that underlying work, then you're much less likely to see an issue continue or recur. One great example is blood sugar issues. This is kind of like peripherally related to fertility, because blood sugar definitely does cause issues for fertility, but like being on the road to type 2 diabetes, like who wakes up one day as a type 2 diabetic? Like you weren't not diabetic yesterday and you're diabetic today. Like you've been on that road for a while. And if we do a more functional assessment of your blood sugar balance 2 years, 3 years, 5 years before you get that diabetes diagnosis, that's a place where we can recognize that there's an issue and intervene and address some of those
Right.
underlying causes, so that maybe that person doesn't need to be on medication for the rest of their lives. Because it's incredibly expensive to have a diabetic on insulin. Like what
Absolutely.
that costs to our healthcare system on a yearly basis to have
Yeah.
a diabetic patient on insulin, it's
Yeah.
astronomical, and it's
Yeah.
bankrupting the healthcare system, with 52% of the US population either pre-diabetic or diabetic, and most undiagnosed. So, things like that, there's a huge opportunity to intervene with different tools, correct and investigate those underlying issues, and put clients and patients on a path toward like actually achieving overall health instead
Yeah.
of just treating disease and symptoms.
Right. Increasing quality of life, which
Yes.
everybody deserves to have. And so I wanted to go back to Hashimoto's because I know that it's very easy to miss. Can you share from your perspective why it's easy to miss and what people should do to look into it and what labs they should ask for?
Yeah. So it's awfully easy to miss if you never test for it. And that really is the primary issue conventionally. Most doctors run for a thyroid panel, and I would say 99% of the clients that I see in my practice that have quote had their thyroid tested have had a TSH only, or they've had a TSH and a free T4. And that's
Right.
about it. That's the extent of the thyroid investigation that I typically see prior to clients coming to me. It is necessary to do a full thyroid panel, not just to assess the function of the thyroid from a more comprehensive perspective. So that means TSH, free T4, free T3, and thyroid antibodies at the least. I also include total T4 and T3 as well as reverse T3 in my thyroid assessments. But in order to actually assess for the presence of Hashimoto's, you need to test thyroid antibodies.
Right.
And so at the very least, you need to test TPO or thyroid peroxidase antibodies, so anti-TPO, and also anti-thyroglobulin. And those are the two, if elevated, can indicate that there's an autoimmune response happening to the thyroid. Now, just having those elevated, you would not necessarily qualify for a Hashimoto's diagnosis in conventional medicine. There's also an issue of how high are the antibodies, how significant are the symptoms. The way that I present this to clients in my practice, because once again, I'm not licensed, so I can't diagnose them with a medical condition, is having positive antibodies, whether they're low positive or they're very elevated, indicate that there is an autoimmune response happening to your thyroid
Correct.
tissue. And that will set you up for the eventual development of Hashimoto's if you don't qualify for the diagnosis already from a conventional medicine perspective. So positive antibodies are indicative of an autoimmune response to your thyroid gland. And that could easily result in a Hashimoto's diagnosis in conventional medicine, either currently, depending on your symptoms, or down the road.
Right. Yeah, such a good point. I mean, it should not be dismissed at all because as soon as you see it, that's where you can really get preventative before it continues. Because if it's there, it's there. You can't unsee it.
Right. Well, and the thing I want to highlight, and the reason that this isn't tested for conventionally, is that the treatment for hypothyroidism by the way, 80% of which is caused by Hashimoto's thyroiditis. The reason that it's not assessed for, even though it's so common, is that the treatment for hypothyroidism in conventional medicine is synthetic T4 medication. There's also T3 medication, but it's given fairly infrequently. So pretty much T4, levothyroxine, or a brand name of levothyroxine is what's going to be given in those cases. And the provider, there's no additional, like, it doesn't change their treatment to know whether there's antibodies. They're still going to give synthetic T4. So why order a test that doesn't change your treatment?
Right.
But in functional medicine, we're not necessarily always trying to treat with drugs. Like, if you're a licensed provider, you might recommend that. But if you're somebody like me who's working in a functional medicine paradigm, I'm looking more at the dietary, the lifestyle contributing factors. Like, what can we do to either, I guess, arrest that autoimmune response, or how do we keep it from becoming more significant? Like, if your antibodies are just low positive, how do we prevent that from becoming full-blown Hashimoto's at some point in the future? How can we intervene and change diet and lifestyle, turn off some of those things that are going to be, that are going to cause that autoimmune response to kind of flourish in the body? And those aren't tools that are typically taught or offered in that more conventional paradigm. And so that's why it's so important to assess for antibodies, because there are things that we can do on the functional medicine side to address that.
Right. And another thing I want to mention and point out is the fact that most people associate hypothyroidism with Hashimoto's. However, people can start out as having both hyper and hypothyroid symptoms.
Yes.
So it's confusing.
It's very confusing. So with Hashimoto's, you could do a TSH test like 6 months in a row. And you could see maybe 2 of those months you're hypothyroid, 3 of those months you're hyperthyroid, and another month where you're in a euthyroid state. So you're like, your TSH is actually perfectly fine and within range. Range is another thing that we didn't cover, which is the conventional range versus the more functional medicine range, which is very different. So just to give people a sense of that, if they're not familiar with those ranges, typically a normal result in conventional medicine will be between, like, depending on the lab, so this will differ a little bit, but it'll be between like 0.5 and 4.5. But for fertility purposes, we want to see it under 2.5. And really just most people feel their best between a TSH of 1 and 2. So that's something important to note. But yes, Hashimoto's can cause you to be in any of those 3 states at a given time. And there actually is a small percentage of people who do have Hashimoto's. They do have inflammation in their thyroid gland, but they actually don't test positive for antibodies. And so you can identify the presence of inflammation in the thyroid gland with a thyroid ultrasound. At that point, that definitely would require cooperation of a licensed provider to order and provide that for you. But that is another important thing to know. So Hashimoto's can be a difficult situation, number 1, to get assessed for in the first place. Number 2, even to identify with proper testing. And then trying to figure out how to treat that at that point, with synthetic T4 medication. That doesn't work for everybody. So there are some other medication options, but really it's addressing what are the underlying factors that led to the development of that autoimmunity? What can we do to manage those better? So I personally am not currently medicated for my thyroid. That is not a value judgment on anybody who is. That's just me saying that at this particular point, I'm able to manage this autoimmune issue well enough with diet and lifestyle that I don't require medication at this time. That doesn't mean that I won't ever require thyroid medication.
Right.
And I'm sure that there have been points in the last couple of years where I probably should have tested because I could tell my symptoms were flaring. And I probably could have benefited from medication in those situations. But really for me, the primary focus is addressing that root cause of the inflammation and the autoimmunity. Now, if you're out there actively trying to conceive, you do also want to make sure that you are medicated appropriately if that's required in your situation. Because thyroid is such a huge risk factor for infertility and miscarriage, that you don't want to let that go untreated. And this is where conventional medicine plus the functional evaluation is really optimal for addressing thyroid conditions.
Yeah, good point. And I also want to address the iodine controversy.
Oh, please do.
For Hashimoto's.
Yes.
Some people will say do not take iodine if you have Hashimoto's. It can make it worse, or it can irritate it. And then some people say no. As a matter of fact, one of the reasons why you may have high iodine is because their thyroid is attracting certain chemicals in place of iodine, where it's supposed to actually take iodine to function. I want to get your thoughts on this. This is not my expertise at all. So I wanted to see what you...
Yeah, so both of those things are actually true. So iodine deficiency can result in elevated antibodies. However, giving supplemental iodine can also exacerbate an autoimmune condition because giving iodine can increase the production of TPO, thyroid peroxidase. Now, if you're producing thyroid peroxidase antibodies and you increase TPO production, what are you also going to do at the same time? You're going to increase the production of antibodies as well. More TPO equals more antibodies. So you can exacerbate or even cause an inflammatory response in the thyroid gland by supplementing at high doses with iodine.
Okay.
I actually am about to address this in an upcoming podcast episode. Somebody asked me, is it safe to self-medicate with iodine? And they haven't had a thyroid panel. And I'm like, no, it's not, because you do need to make sure that autoimmune response isn't happening if you're going to take supplemental iodine. Now, when I say supplemental iodine, I mean anything that would be above about 300 micrograms a day, which is the prenatal that I most often recommend, I think has like 250 or 290 in it. Most people do okay on a lower dose of iodine that would be available in a high quality prenatal vitamin, which most women are going to be on if they're in a fertility setting or they're trying to conceive or they're pregnant. And so that does okay for most people. That doesn't mean for all people. Personally, just putting that out there. If you have Hashimoto's or you suspect that you might, you need to be working with a practitioner that can advise you appropriately on supplementation. So there is a risk of having elevated antibodies with iodine deficiency, but there's also a risk of causing an autoimmune flare with supplemental iodine. And then there's what you're saying about certain toxins that can displace iodine in the formation of thyroid hormone. So there's heavy metals can do that, number one. But there's also a whole class of chemicals known as halogens. So like chloride and bromide and fluoride that can interfere with the placement of iodine in thyroid hormone. And what can happen is you start giving a lot of iodine and you cause this like big displacement of a bunch of chemicals all at once. That can cause some inflammation and flare and some unpleasant symptoms. So it is really important to be working with someone that can advise you appropriately on how to do that, how to do it safely, how to do it appropriately, and make sure that you're setting yourself up for success and not symptoms.
Right. So just to recap, under 300 shouldn't cause anything, micrograms shouldn't cause any major issues. It's most of the time in prenatals anyway. However, more supplementation, or if you think that you have any symptoms or Hashimoto's, you should go to an endocrinologist.
Right. Yes.
Yeah.
Go to a functional medicine practitioner that is familiar with how to appropriately supplement with iodine and monitor you for symptoms. So for most people, that 300 microgram threshold will be okay. Some people, it might even be a little bit lower. There's also other nutrients that are important for thyroid function, like selenium, and selenium can help buffer some of the reaction to iodine supplementation in some people. There's also a big difference between supplementing with 200 to 300 micrograms in a prenatal vitamin versus 12.5 milligrams, which is what some practitioners are recommending for iodine supplementation. So there's a lot of room in between. There's also different forms of iodine to supplement with. There's also focusing on iodine-rich foods in your diet, which we have definitely gone away from, and at least in a more Western type of diet. So that's going to be things like seafood and sea vegetables are going to be some of the highest sources. Now we have iodized salt still in this country, which really I've read some studies about that more recently, that actually having iodized salt, like places that have that do tend to have more occurrence of thyroid antibodies in people.
Oh my God. Wow. That's interesting.
Yeah, well, so don't super quote me on the research. This is relatively recent. I just read a couple of papers that were looking at the incidence of thyroid antibodies in places where most salt was iodized. So I think really it was just meant to provide like a bare minimum amount to prevent goiter, really, and neurological and developmental deficits in kids, which is a big risk factor of having hypothyroidism. Low thyroid hormone production is developmental delays in babies. And so iodizing salt's kind of the same thing with like adding folic acid to processed grain products to try to prevent neural tube defects. Now we're seeing research saying, hey, synthetic folic acid in our grains,
Right.
probably not the best idea. And there may be some unintended health consequences of doing that. We're also getting more folic acid in grains than was originally planned when we made this change to start including it in food. So I think iodized salt, not the best place to get your iodine, in my opinion. So I want to throw that out there, that it is a source. People bring it up. A lot of people think that because salt is iodized that nobody's iodine deficient, and that is completely untrue. That it's just a bare minimum that's in there to try to prevent goiter. It's not really a therapeutic or a nutritionally appropriate amount to eat on a regular basis.
Right. Good point. Yeah, there's all these things that we don't know about, and it's automatically supplemented for us. And just so people know that folic acid is a synthetic form of folate, and it's not processed in the body of a lot of people, especially people with MTHFR gene mutation, and it can really be detrimental for pregnancy. And also, I just actually wanted to ask you another question. Why, in your opinion, is Hashimoto's more prevalent in females?
Oh, well, all autoimmunity is actually more prevalent in females.
Why is that?
So it's because we're just more hormonally complex. We have a lot more going on in our bodies, and having a monthly cycle, there's so much immune complexity that happens with that monthly cycle. We have this amazing ability to grow and change and create life. That hormonal cocktail, if you will, that changes throughout the different phases of our cycle does predispose us, I think, to more complications with the immune system. And that's a big reason that it's more likely to occur in females.
Yeah. Interesting. Very, very fascinating conversation. I really loved picking your brain. You're very knowledgeable about all of this. And it's really cool to learn more about. I'm definitely starting to learn a little bit more about thyroid hypothyroidism just based on my patient's symptoms and Hashimoto's. And it's fascinating, the whole thing about how just something so simple as changing your diet. I mean, I know it's not simple in the fact that like you have to change behavior and you have to relearn really what to eat. So it could be a little complex, but once you, I mean, we can change behavior. We can handle it. I think once you learn those things, it's incredible. You could like literally save your life. I mean, it's a pretty amazing thing.
It's very empowering. And the other thing I want to mention is like when we were talking about that whole halogen category and heavy metals, like there are things that you can do to reduce your exposure to some of the compounds that disrupt the thyroid. So like a couple of examples, filter the fluoride out of your water. If your water is fluoridated, get rid of that. Like find a filter that filters that out. Fluoride is toxic to the thyroid, and it's also in that halogen category that can displace iodine. Get rid of your nonstick cookware. Also filter.
I mean, I actually have non-fluoride toothpaste for myself and my kids.
Yep, definitely. So no fluoride in dental products. And like, I go to the dentist and I just say, please don't use anything on me with fluoride. And they say, okay. They look at me a little funny, but they do what I say. So that's another just really easy change that you can make. Getting rid of the nonstick cookware. I also have a shower filter that gets rid of the chlorine in my water. So that's another thing that can contribute. So, and that's like a $60 thing that you screw onto your shower head. Like it's not a massive investment. You can do like a whole house filter that does all of your water. We actually do have one, but I started with the $60 shower filter and that made a huge difference for me. So yeah, there's lots of little things, inexpensive things that you can do to start working on some of those toxic exposures that affect thyroid health as well.
So interesting. I really appreciate you coming on. I think that you've given amazing information, not only for my listeners, but for me as well. I mean, it's a lot of really good information about just functional medicine, which is something that I'm really interested in learning more of because I find that it is so helpful. So I find it so fascinating, and I could have kept talking to you. I think we even went over. So this is really good conversation, but I can keep talking to you. So thank you so much for coming on.
Yeah. Thank you so much for having me, Michelle.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.